Sarah, welcome to Woodborough House. This is our Dentistry Cribs. This is our meet and greet desk. So when you first come in, there's a lady here to meet you, to welcome you to Woodborough House, and then behind we've got our reception team. And then you come and have a seat in the waiting room. So it's a nice spacious waiting room. It's a lovely old building. In fact, we've got a couple of photos from Woodborough House, which was originally a home. So it was 1888. That's an Edwardian building that it was first built, and then it was used as a dental practice from about 70 years ago. We always have fresh flowers in the waiting room, changed weekly, and lots of good magazines for people to read, and they're changed monthly. And on the wall here, we have a quartet of pictures of Pangbourne. It's really important to Nick and I that we capture the area around us. Pangbourne's such a beautiful village set on the Thames, and we have got a photographer who's one of our patients who takes photos of Pangbourne, and one of our other patients suggested to us that we do a seasonal quartet. So we had autumn, I think it was, and then she said, why don't you do every season? So this is our summer season that's up at the moment, so we're just about to change back to autumn, and then we had the other pictures distributed throughout the practice. And then if you come through here, it's the beginning of our surgeries. We have got our mission, our values and our vision up for patients to see, and this is particularly important to Nick and I, our vision. So treating people, not just their teeth, is a big value for us. That's what it's all about, and changing lives through smiles, which is something that Nick does miraculously for his patients. So we've got a TCO room here, another winter picture of Pangbourne, and then we've got two surgeries downstairs and our stock storage. And then if we come upstairs, or before we go up actually, we've got a lovely coffee machine here, and then this is Nick's pride and joy. It doesn't excite me quite as much. This is the CT scanner, which is the latest scanner that he uses for his guided surgery. And then if we go upstairs, decon room in here, we have a dedicated decon person, Sally, who's just amazing, and she looks after all our surgeries. Have a bathroom for the patients here, and then we've got 3 surgeries on this level, and also we've got a laboratory. And this is Nick's original surgery. So this is a bit of a man cave. It's very black and manly. And then of course we have the All Blacks jumper on the wall there, 2015 champions. You come back out now, we have a dental laboratory to our right, and we use this for day cases, teeth in a day. Technician Rob comes up from London and spends his day locked in this little room so we can retrofit the teeth after surgery. Right, and this is one of our brand new surgeries. We revamped the practice and placed all the chairs about 18 months ago, so they've all got brand new E80 Cavo chairs and new cabinetry in our brand colour. This is the referral side of the practice, which is the red colour, which is representing Nick. And he loves his technology, so they're state-of-the-art, very expensive chairs. And then we've got iTeros throughout the practice. We've had iTeros since 2007, so we're the second practice in the UK to get iTero. It's been great for his guided surgery. So he's been an instigator of the technology with guided. And so during our refurbishment in the last 18 months, we've extended the building because Nick needed more room and he really wanted his own space where he could treat patients. So I'm going to hand over to Nick and he's going to show you around his side of the building. Hi Nick, your turn.
Hi, welcome to my side of the shop. I'd like to just welcome you to come in and see what we're doing here on a routine basis, how our workflow goes with the patients. So this is the first of my rooms. I'm a lucky boy, I've got 3 surgeries, and this is where I do my consultations, new patient consultations, and anything that, let's say, was fairly non-invasive.
No blood.
No blood, yeah. Or no sedation in particular, because the stairs is a slight barrier to people who are heavily sedated. So we've got things like lots of toys, as Sarah I'm sure has alluded to. We've got things like the mod jaw, which allows us to look at the jaw movements in 4 dimensions, so time and motion studies. These are very useful when we're doing larger cases for reducing the amount of equilibration that we have to do when we're doing like our all-in-4 type treatments. Recently replaced all the chairs. We've gone with Cavo chairs. Sarah and I actually trained originally in Otago on Cavo chairs, so that was one of the main reasons for doing this. We also got a reasonably good arrangement because we bought so many chairs, and not to mention the fact that we went with Cavo because of the fact that it's an easy chair to find somebody to service, so everything works throughout the practice. So I've got a little bit of TV screen here, so I've got a little bit of woo-woo stuff on there to give me, like no compromise. Organisation is everything to try and keep me on track. I'm going to move to my big screen. I find this really useful for showing patients. We do a lot of implant treatment, so we can show them the proposed treatment, what we're suggesting. And I know this is very successful because this is my mum. I did this about 20 years ago and she's still got all the teeth, so this is good. One of the new acquisitions we've got is a 3D facial scanner. Now, I think there might be a couple of people in the UK using this, but I think that the direction dentistry is going, I think facial scanning will be like intraoral scanners. I think that in 5 years' time, every practice will be using them. And the reason that we like using them, if I push this out of the way, is that we can introduce the facial scans in and then merge our intraoral scans and then merge our planning with the 3D planning from the software. And this once again allows us to really streamline the treatments. And what we're looking to do is this whole cliche of working smarter, not harder. A lot of people know I'm very passionate about digital dentistry, but the whole idea is it's good for us and it's good for the patient. Got a little semi-photo studio down here so I can take pictures of the patient for planning, and then also a little box here that we can use for taking photos of the lab work, so presentations look nice. Right, so if you follow me, I'll take you down to where we do, just before I sign off on that, this is a room where I've got my treatment coordinators. It works really well. So the patient's had a new patient consultation. They just come in here, can't go downstairs and escape. They have to book in effectively. Likewise, when you're reviewing your surgeries, maybe taking your sutures out, slip them in here, make sure they've got the next appointments working. So this really, really works well. So follow me. When people, on the day of surgery, when somebody comes in and they've got complicated surgery, they might be nervous. Most of the time they're having some form of sedation. We don't want them waiting out there with everybody else. So we bring them in here. They can have their paperwork filled out. We can make sure that they understand everything, that they're fully consented to the process. If there is any money left to pay, they can pay it. We normally take money in advance, so this shouldn't be an issue. But it's just nice for them to have their own little space. When we're ready for them to proceed, we then go into this room, which is just really a room that we use for putting in lines, giving sedation. We clean the patient's teeth before we do the surgery. If they needed to have a bridge removed, we'd remove that in here so the surgical suite remains really clean. So it's all the preparation work. Likewise, we give sedation quite often, and it's nice for them to have just a little quiet time in here to relax before we take them through. So if you follow me, what we've got here is a surgical suite. So pretty much all we do in here is effectively, I'll tell a lie, if somebody is, can't get up the stairs, we might see them in here and do some restorative treatment on them, or if we have people who need to be sedated for their restorative treatment. But the general thrust of this room is it's just entirely geared for giving surgical treatment, whether that's the maxillofacial surgeon in here doing zygomatic implants, whether that's me doing my implants, whether that's one of the associates doing implants, or we've got an oral surgeon who comes in and takes teeth out. So this is what this is for. So we've got backup suction that we tend to use most of the time because it's so good, and that allows us not to worry about the suction too much, especially if we're using like navigation. So this is a system for surgical navigation. Now I still love my guided, but I think there's a place for both guided and navigation in a digitally driven world, and certainly although both have advantages and disadvantages, when you use them together, they're very powerful tools. And I personally think that, you know, if you're going to take the CT scans, normally we have the CT scan on the TV screen up there, any planning for the implant treatment that we're doing, you know, then some form of assistance to help you with delivering the treatment like you planned on your CT scan is really quite useful. I always think if you're doing a reasonable amount of implants, it's nice to have a good stock of what you've got. So this is effectively what we've got here as a consignment stock. So, you know, we never need to worry too much about whether we've got implants, because we've got all the implants. And apart from that, oxygen, etc., all the sort of things that you'd want. And we've got a whiteboard that we use for writing up over here, so not very technical, but this is one of my favourite things, because, you know, we can write up all the details about what the patient's doing, and then we can, you know, either tick things off as we do it, or write down things that we need to put into the notes. When we're doing the IV sedation, it's very easy to keep track of what's going on, so very beneficial. So if you follow me, we'll come into where we've got the CBCT scanner. So I'm really amazed by the quality of the CBCTs we get from this machine. So we were sort of forced into doing it. I don't think I ever would have got a new CT scanner apart from legacy issues. So our old CT scanner was running on Windows 7, and then when it was stopped being supported, we needed to get another option. So mercifully, Sarah allowed me to negotiate with Marita, and we bought this bad boy, which, you know, as far as the scans that I've seen, this across the board is as good as anything you'll get, certainly outside of a hospital anyway. And this is, so we can take the KEFs, we can take an OPG, and we can take the CBCT scan, but where it really wins to me is the CBCTs, and that's from the small volume ones that we use for endodontics, through to more general ones that we'd use for planning for implants, the periodontist might use, and then we've got the ability to do huge scans as well, so for the zygomatic treatments that we're providing. So all in all, considering it's quite a small space, it packs in a lot of resource. Right, so thanks for coming and allowing us to show you around Woodborough House, Sarah and my baby. Anybody who wants to get in touch, find out anything more about us, feel free to drop us a line.